Welcome to the training on occupational health, environment and safety. Let us learn the module on first aid for burns. Before we begin, let's take a look at the key learning objectives. After completing this module, you will be able to define burns, recognize and list degrees of burn, demonstrate first aid for minor and major burns, explain complication and prevention of burns. Let us find out what a burn is. A burn is a type of injury to flesh or skin caused by heat, electricity, chemicals, friction or radiation. Burns can be minor medical problems or life-threatening emergencies. Some of the most severe burns are caused by electricity or chemicals. Now let us see what causes burns. Firecrackers or explosion of flammables, hot liquid or steam, hot metal, glass or other objects, electrical currents, radiation from X-rays or radiation treatment for cancer, sunlight or ultraviolet light from a sun lamp, chemicals such as strong acids, paint thinner, etc. Let us see how to evaluate the severity of a burn. Burn severity is dictated by percent total body surface area TBSA involvement. Rule of 9 is used as a rough indicator of percentage total body surface area. Let's look at the table given to understand Rule of 9 for establishing extent of body surface burned. Anatomic surface, percentage of total body surface. Head and neck, 9%. Posterior trunk, 18%. Arms including hands, 9%. Each leg including feet, 18%. Genitalia, 1%. In infants, the severity of burn is different due to their sensitive and delicate skin and body parts. Please look at the image and the table to know the percentage of burns in case of infants. Depth of the burn is evaluated by degrees of burns. Let's learn about degrees of burns and who are more prone to burns now. Children and elderly people are more prone to burns as their skin is very sensitive. Commonly, there are 3 degrees of burn depending on the depth of injury. First aid treatment differs based upon the type of burns. First degree, superficial burn. The skin is usually red. Often there is a swelling, pain present sometimes. Second degree burn. Blisters develop, skin takes on an intensely reddened, splotchy appearance, and there is severe pain and swelling. Third degree. Painless and involve all layers of the skin. Involves injury to deeper tissues such as muscle or bone. Deep or widespread burns can lead to many complications. Infection, loss of body fluid, hypovolemia, dangerously low body temperature, hypothermia, breathing, respiratory problems, scarring, bone and joint problems. Now let us see how to treat different classes of burns. Burns need immediate first aid. If they are not treated right away, they may cause painful blisters and infection. In case of third-degree burns, it may be life-threatening. Minor, first and second-degree burns can be treated at home. For major, third-degree burns, we need to seek emergency treatment. We need to call for medical assistance if there are serious burns that cover the hands, feet, face, groin, buttocks, or a major joint, chemical or electrical burns, third-degree burns, burns to the airway which cause difficulty in breathing. Now let us see the steps to be taken to treat minor burns. 1. Cool the burn. Run cool tap water over the burn or put the burned areas in room temperature water for 10 to 15 minutes. Do not use ice or ice water. Putting ice directly on a burn can cause further damage to the wound. 2. Clean the wound. Use mild soap and tap water to wash the injury. 3. Apply antiseptic cream or aloe gel. Try anesthetic cream or aloe gel to soothe the area and prevent dryness. 4. Cover the burn. Wrap a sterile gauze bandage loosely to avoid putting too much pressure on the burn. 5. Medications. Take painkillers, analgesic and anti-inflammatory, anti-tetanus vaccine according to the doctor's advice. Minor burns can happen any time. Let's learn about some immediate home remedies for minor burns. After the burn is cooled under water, and if you don't have antiseptic cream or aloe gel, you can use any of the following home remedies. Use a salt solution, apply vinegar, soak the burn in black tea, soak the burn in milk, apply honey. For major burns, immediately call for medical assistance. Take care of the patient for safety and comfort till medical professionals arrive. Do not remove burned clothing. Do not immerse large, severe burns in cold water, which can lower the temperature of the body. Check for signs of circulation, breathing, coughing, or movement. Elevate the burned body part or parts. Cover the area of the burn using a bandage or clean cloth. We tend to make mistakes sometimes while treating minor burns at home. Let's see the caution to be taken during first aid for minor burns. Do not apply ice to your burn. It will cause damage to the wound. Do not put creams, egg whites or butter on your burn. It will cause infection. Do not pop blisters or pick at a burn. It will cause infection. Now let us see how to prevent burns. Never leave items cooking on the stove unattended. Keep hot liquids out of the reach of children and pets. Never cook while wearing loose-fitting clothes. Avoid smoking in the house and especially never smoke in bed. Keep chemicals, lighters and matches out of the reach of children.
Burns can be caused by exposure to flame, heat or other forms of radiation, contact with hot or extremely cold objects, liquids or gas, or contact with chemicals. There are three main classifications of burn injury: superficial, partial and full thickness burns. A superficial burn is where only the top layer of the skin is involved, such as sunburn. This usually heals well and should not require medical attention unless it covers more than 10% of the body. A partial thickness burn is where the top layer and second skin layer is damaged, giving rise to rawness and blisters. These burns require medical attention. A full thickness burn includes both outer layers of skin and the underlying subcutaneous tissue. Urgent medical attention is required. Move the casualty to a safe environment. Immediately cool the affected area with slowly running cool water for up to 20 minutes and remove all rings, watches and jewellery. With large burns, only the affected area should be cooled, as there is a danger of the casualty suffering hypothermia. Clothing stuck to the skin should not be removed. Elevate burnt limbs where possible and cover the burnt area with a clean or sterile non-stick dressing. In major burns, fluid loss and pain can cause life-threatening shock. Where burns have occurred to eyes or a chemical has been splashed into them, they must be flushed with cool, flowing water for 10 minutes, 20 minutes for chemicals. Both eyes should be covered with an eye pad and medical attention urgently sought.